Good afternoon, and thank you so much for joining us today. My name is Katie Baker, and I am the Virginia State Director for Protect Our Care. We are a nonprofit organization whose mission is to strengthen and protect healthcare, and we do so largely through press events such as this. As many of you know, May is both Older Americans Month and Asian American and Pacific Islander Heritage Month. So we wanted to take this moment to highlight the specific work that President Biden and Democrats in both Congress and the General Assembly have done to make quality healthcare more affordable for both of those communities. They've done that largely through the Affordable Care Act and the Inflation Reduction Act at the federal level, and most recently at the state level through very significant investments in the budget, which Senator Hashmi and Caucus Chair Kathy Tran will speak to. Just to give a sense of the number of folks in Virginia who are going to be impacted by these policies in these communities, Virginia has about 1.4 million people who are over the age of 65, which is a significant portion of our population. That number creeps up to close to 2 million when you factor in Virginians who are older than 60. And there are well over 500,000 Asian Americans in the Commonwealth, and this is also a very rapidly growing population. And then as we celebrate these investments that we're making in healthcare for these communities, I also want to remind everybody that there is a clear contrast here when it comes to our values. Not a single Republican voted to bring prescription drug prices down through the Inflation Reduction Act. Governor Youngkin recently vetoed legislation that would have created a prescription drug affordability board, and Donald Trump has said that he would terminate the Affordable Care Act. And so with that, I'm going to give the floor to our legislative leaders who are really leading the fight to ensure access to affordable healthcare for these communities and for all communities in Virginia. And so it's my honor to introduce you to Senator Ghazala Hashmi, who is the chair of the Senate Education and Health Committee. Senator.
Well, good afternoon, and thank you so much, Katie, and thank you to everyone who's joining us this afternoon. I am glad that I could join you as we close out Older Americans Month and Asian American and Pacific Islander Heritage Month. So these two particular recognitions this month are so important for many people, certainly here in Virginia. As the chair of the Senate Education and Health Committee and as the first Indian American to serve in Virginia's Senate, I think it's really important that we take a moment to celebrate the big and the bold health care victories that Democrats have secured for both of these communities. So I also proudly serve as the vice chair of the Virginia Asian American and Pacific Islander Caucus. And in that role, I'm committed to building the political power that's necessary to ensure that AAPI issues continue to be a priority in Richmond and throughout the Commonwealth. The Pan-Asian community is united in demanding that our voices be heard and that our needs, especially the needs of our seniors, be addressed. Representation matters, as we all know, and the toxic myth of the model minority can lead to governments underfunding services that directly benefit our communities and their members. But fortunately, both older Virginians and AAPI Virginians have a lot to celebrate this year. Our recent budget negotiations ended with Governor Youngkin signing a budget that is nearly identical to the bipartisan budget that we had passed earlier this year in our session. And I was very proud to help craft that budget as a member of the Senate Finance Committee. This budget includes pay raises for home health care workers so that people who take care of our seniors can be more fairly compensated. And this budget also includes an additional $40 million in funding for nursing homes that meet important metrics to ensure that they're providing the highest level of care that's possible for our seniors. And as we think about how we can better serve the AAPI communities, we must make sure that healthcare is not just affordable, but that it's also accessible. About 212,000 people in Virginia report that they either do not speak English or they do not speak English well. And about 29% of those individuals speak Asian languages, such as Korean, Vietnamese, Chinese, Hindi, Arabic, Farsi, and Amharic. That's why I was proud to be a chief patron of a budget amendment to include $2 million in new funding to improve language access across Virginia and Virginia state agencies so that everyone, regardless of their English proficiency, can access the resources that they deserve. And this new funding will improve the AAPI community's access to Medicaid as well as to other healthcare services. And thanks to President Biden and the congressional Democrats, older Virginians and AAPI Virginians are also seeing their healthcare costs go down because of the Inflation Reduction Act. This landmark legislation has given seniors on Medicare access to free vaccines, including the shingles vaccine. And additionally, the IRA capped their out-of-pocket prescription drug expenses at about $3,300 in 2024. And beginning in 2025, that cap will be lowered to $2,000 a year. The Inflation Reduction Act has also renewed the Affordable Care Act's premium tax credits, meaning that about 197,000 AAPI Americans have become newly eligible for a savings on their monthly premiums. It was the leadership of Democrats in Congress and in the General Assembly that delivered these concrete victories for both of these communities. And it's the core belief of our party that we should be expanding access to healthcare, not trying to rip it away. We cannot take these accomplishments for granted, however, because we know that the Republican threats to healthcare are real. Donald Trump has already doubled down on his promise to repeal the Affordable Care Act, and that will kick millions of Americans, including many of our friends and neighbors here in Virginia, off their health insurance plans. And Governor Youngkin this year vetoed legislation that would have lowered prescription drug costs and guaranteed the right to use contraception, including IUDs and Plan B. But I have one clear message to all of our friends and families in Virginia. As long as I serve as chair of the Senate Education and Health Committee, we are not going to go back on our progress. I'm going to continue to be a part of the brick wall and block any efforts that would undermine access to healthcare, especially healthcare for older Virginians and AAPI Virginians. Thank you so much for allowing me to join you. And Katie, I'll give it back to you now.
Thank you so much, Senator, and thank you for your leadership. I know every issue impacting healthcare, any bill that's introduced on healthcare goes before your committee, and I just really appreciate all the work that you do. And next, it's my honor to introduce another healthcare champion. Delegate Kathy Tran serves as the chair of the Virginia House Democratic Caucus. Delegate.
Great. Thanks so much, Katie. And really appreciate you and Protect Our Care for inviting me to join this important conversation today. As Katie said, I'm Kathy Tran, and I'm the Majority Caucus Chair and represent the 18th House District, which includes parts of Fairfax County in the Virginia House of Delegates. Many of you know my story, but I'm also an immigrant. My parents and I came to this country as boat refugees from Vietnam when I was a toddler, and I'm really proud to be the first Vietnamese American elected to the Virginia General Assembly. As Senator Hashmi and Katie have mentioned, May is Older Americans Month and Asian American Pacific Islander Heritage Month. Older Virginians and AAPI Virginians make significant cultural, social, and economic contributions to our Commonwealth. And in fact, AAPIs are the fastest growing demographic in Virginia and across the country. After years of Republican obstruction, our Democratic gains in 2017 made Medicaid expansion possible in Virginia. That truly was one of the most consequential votes that I've ever taken. And since we expanded Medicaid, about 940,000 adult Virginians have received vital healthcare services, including 100,000 Virginians over the age of 55. Medicaid expansion has filled a vital gap for income-strapped seniors who are not quite old enough to qualify for Medicare. Medicaid is also a vital tool to closing healthcare disparities, particularly for underserved communities of color. Currently, Virginia's Medicaid program covers over 100,000 API Virginians, and I've been so proud to help strengthen our Medicaid program over the last few years. In Virginia, we've removed a 10-year work requirement before you're eligible, which is really important to so many of our immigrant and refugee communities. We've also expanded services that are covered by Medicaid, including postpartum care and dental coverage. And we've increased reimbursement rates so that Medicaid recipients can have more options when they're looking for care providers. In our budget negotiations this year, House Democrats fought and won to keep important healthcare investments, such as for federally qualified healthcare centers and free clinics, which are crucial resources for new Americans. You can compare that with Governor Youngkin's budget, who didn't prioritize these facilities at all in his original budget proposal. He was too focused on restructuring the tax code to benefit the ultra-wealthy. And I'm so proud that House Democrats are doing more to expand healthcare while improving the lives of marginalized communities. This year, we passed almost unanimously legislation to create a pathway for internationally trained physicians to get their medical license, enabling these refugees and other new Americans to reach their full career potential while meeting the needs of underserved communities, including rural areas where populations trend older. We also passed my bill to reduce the number of years that a nurse practitioner must be supervised before they can practice autonomously. This will help expand high-quality healthcare and address our medical professional shortage. At the federal level, Democrats in Virginia's congressional delegation delivered for older Virginians and API Virginians by working closely with President Biden and Vice President Kamala Harris to pass the historic Inflation Reduction Act. Just want to echo and lift up some of the things that Senator Hashmi had noted, that this law continues to save Virginians money on their healthcare costs. One of the new provisions that went into effect this year will limit annual premium increases for more than 500,000 Virginia seniors, including API Virginians, on Medicare Part D. The Inflation Reduction Act is also lowering monthly healthcare premiums for about 283,000 Virginians who bought health insurance through Virginia's new state-run healthcare marketplace. Around 48,000 API Virginians enrolled in a healthcare plan last year, meaning the Inflation Reduction Act is helping lower healthcare costs for API Virginians across the Commonwealth. And just want to echo what Senator Hashmi said in pointing out that these accomplishments were all thanks to the work of Democrats. Not a single Republican voted for the Inflation Reduction Act, and congressional Republicans are backing a presidential candidate who continues to state that he will repeal the Affordable Care Act. Repealing the Affordable Care Act would just be so harmful to many people across Virginia. It would repeal Medicaid expansion in the Commonwealth and other states and jeopardize healthcare for hundreds of thousands of our fellow Virginians. About 1.6 million APIs have healthcare coverage nationwide due to Medicaid expansion. So just think about the impact that repealing the ACA will have on so many people. That's why I'm so proud that my friends in Congress, Representatives Don Beyer, Jerry Connolly, Jennifer McClellan, Abigail Spanberger, Bobby Scott, and Jennifer Wexton, as well as our U.S. Senators Tim Kaine and Mark Warner, will stand up to any Republican effort to take away people's health care. There's a lot to celebrate this month, and I'm thankful to have been a part of efforts to lower healthcare costs for older Virginians and API Virginians, and I hope that we are all committed to continuing this fight. Thanks so much.
Thank you so much, Caucus Chair Tran. And I know in your role, your leadership role there in the caucus, you have just so greatly contributed to ensuring that Democrats are the party of healthcare. And next, I am very excited to introduce the Mid-Atlantic and Southeast Regional Director for South Asians for America, and that is Shamali House.
There we go. Now I'm unmuted. Thank you so much to Protect Our Care for having me today as we celebrate Older Americans Month and AAPI Heritage Month. And thank you to Senator Hashmi and Delegate Tran for all the work you do and continue to do as our healthcare champions for our community. I too am an Indian immigrant and an Air Force veteran. And in my role as a Mid Atlantic and Southeast Regional Director for South Asians for America, I work every day to build power, political power for our community here in Virginia and across the DMV area. I also work broadly with other AAPI communities. Representation is important for many reasons, but I wanted to touch on something that Senator Hashmi said about the myth of the model minority. If our elected leaders see us as a monolith, then they won't see our community's needs. What most people don't realize is that there are great economic disparities in our community. There's a stereotype that all Asians are successful and financially comfortable, and it's just not true. We actually have the entire breadth of the socioeconomic spectrum in our community. We need to be seen in all of our complexity in order to ensure the needs of our communities are being met. We have both the richest of the rich and the poorest of the poor, and I appreciate all the work that our Democratic leaders have done to strengthen Medicaid because so many of our Asian American community members rely upon it. It's also critical that we protect the Affordable Care Act and the Inflation Reduction Act for our small business owners, which is also a large part of our AAPI community. And we have such a rich history of entrepreneurship. Um, Especially in the Chinese American community in particular, part of that history is rooted in the Chinese Exclusion Act. There was an exception in the law for business owners. So our small businesses are at the core of our communities. But until the Democrats passed the Affordable Care Act, it could be very hard for self-employed and small business owners to be able to access health insurance. The ACA was a game changer for business owners in our community. Protecting the Affordable Care Act means we're protecting Asian-owned businesses. And since it's Older Americans Month, I just wanted to make a final note on our seniors. Asian Americans often live in multi-generational households. And as Senator Hashmi pointed out, we have many whose primary language is not English. And so having elder care availability with language access is very important. And we see that even at the local level, our Democratic elected leaders are really working hard to ensure that older Americans have language access programs available to them and are also taking a look at how we zone for housing so that we can have those multi-generational homes in our communities. So I appreciate everything that our Democratic leadership has done across the Commonwealth of Virginia. Thank you again to our legislators for all you do to promote the health care of our communities and to protect our care for hosting this event.
Thank you so much, Shamali, and for your words, and for your advocacy. And I'm very excited next to introduce folks to Irvin Varconi. Our storytellers are really the heart of our events. Sometimes I think we get really caught up in policy and we don't always remember the actual impact when we're talking about a lot of numbers on the actual families and seniors. So Irva's going to share his story about how the Inflation Reduction Act is helping him save money. Irv?
Thank you so much. Hello, everybody. I'm a 73-year-old retiree living in Fairfax County. For the last couple of decades, I have had to deal with increasingly severe psoriasis. The most effective medication that has worked for me is Skyrizi, which I've been taking for about 5 years. When I had private insurance, my copays were $5 per injection, taken 4 times per year. But once I went on Medicare 3 years ago, my copay zoomed up to $5,000 for the year. Each subsequent year, my copays increased until they reached $8,000 in 2023. That's just for that particular drug. The retail price per injection is about $20,000. Incredible. So along with other prescription drugs that I take, my copays could reach $12,000 per year. That's just the copays. I was not eligible for any price relief from the manufacturer of the drug, who makes billions, but I had no choice but to continue with this medication given this chronic and lifelong medical issue. But this year, 2024, the situation has dramatically improved for me. In the first quarter of 2024, I spent over $3,000 on my various prescription drugs, and I quickly reached the catastrophic level for my plan's prescription D ceiling, in effect for the first time thanks to the Inflation Reduction Act. And now in the second quarter, I paid 0 copays for Skyrizi and my other drugs. One other drug is Lubistrone, which I had a previous copay of almost $500 every 3 months. Now cost me $0 in this quarter. This has come about as the Inflation Reduction Act capped my annual copays at $3,250 under my prescription D plan. And next year, as Katie had mentioned, the cap on my copays will be further reduced to $2,000. I and all of my fellow Medicare recipients are so grateful for the leadership of President Biden to recognize that solutions had to be found to reduce the enormous potential costs of high-end prescription drugs. Retired seniors such as I rely on limited income from Social Security along with their retirement savings. Thanks to the leadership of the president, I can save thousands of dollars each year. What can I do with this money? Well, perhaps I can pass it on to my grandchildren. They have many needs and their parents have many needs. I'm afraid, though, of what will happen if President Biden is not reelected. Will a different president ask Congress to rescind the Inflation Reduction Act? Will seniors like me have to once again pay thousands in copays? Will a different president eliminate the IRA and use the savings to cut taxes for the wealthy? The IRA is reducing inflation as I will be spending less on prescription D copays. And the IRA will further reduce inflation as it negotiates lower prices for Medicare. Every Medicare recipient, regardless of their political party, will benefit. I also appreciate the efforts that Senator and Delegate have taken for Virginia to reduce prescription drugs as well, and hopefully we'll be successful in the coming session. Thank you, Katie, very much.
Thank you so much, Irv, and thank you for sharing your story. Next, I'm going to turn it over to my colleague Fletcher for the Q&A.
Thanks, Katie, and thanks so much to all of our great speakers today. Folks watching through Zoom, you can use the Q&A feature at the bottom of your Zoom screen to leave a question there, and I'll read it out for the panel. Or if you're watching through Facebook, you can leave your question as a comment, and I'll read it out there. I'll give folks just a moment to type out those questions. Yeah, we have a question coming in for you, Senator Hashmi. As chair of the Senate Health Committee, what do you see as the greatest challenge the state is facing in terms of healthcare?
Well, thank you for that question. That is such an important issue because there are so many issues that are going to be continue to be great challenges for us as we continue to think about healthcare access, affordability, and availability throughout Virginia. So thinking about some of the challenges we have seen most recently and the ones that we are continuing to focus on, they're a combination of issues that rise to the top. The shortage of workforce within our healthcare system is a serious concern. And it's not just staffing shortages in the full spectrum of nursing care, but it is also impacting our hospital systems with the staffing of physicians. It is the staffing of our local health departments and community health workers that provide such necessary care. So ensuring that we have a strong and a high quality pipeline for meeting the workforce challenges is critically necessary. Why that becomes even more important is that we know in Virginia we have an aging population. We have a rising population of seniors who are going to need more care in assisted living, in memory care facilities, and just in functioning within their own homes. And so being able to address the needs and the concerns of the rising senior population through effective workforce development is something that we absolutely have to focus on. Apart from that, as we've heard today, lowering the cost of care is absolutely essential. We don't need medical debt to pile onto any of our families. We don't need prescription prices to be out of reach to the point that life-saving medications are not possible for Virginians. So all of those are really critical areas that we're focusing on, not just in the education and health committees, but also in our Joint Commission on Healthcare.
Thank you, Senator. We have another question coming in for Caucus Chair Tran. I know you hold a lot of town halls and are very engaged with your constituents. What are you hearing from them about their greatest concerns relating to healthcare?
Thank you, Fletcher. I think we've had over 10 town halls this year already. But I think one of the biggest concerns, and it was something Senator Hashmi just mentioned, is around prescription drug affordability. When I was knocking doors last fall, I met a mom who was telling me about the tremendous costs that it takes in order to purchase the medication that her daughter needs to take care of her health, and how that has been so stressful for her family, and how grateful she is that she has really good healthcare coverage, but how worried she is for other families who are dealing with this issue. And that's something that I've heard over and over the years. People who come into their pharmacy, and then, when you get your medicine, that's when you, at the checkout counter, that's when you learn how much it'll cost, right? And then having to turn around and say, hey, I can't do this now. And so we really need to be able to tackle that. We had a bill that would have established this prescription drug affordability board in Virginia. I think it had bipartisan support, but unfortunately was vetoed by Governor Youngkin. And this is not a partisan issue, right? Anywhere that you live in Virginia, whatever your political stripe is, when it comes down to whether or not you can afford life-saving medicine, we should put that issue forefront. So hopefully we'll be able to make inroads on that issue and help reduce the costs that are really burdening our families.
Thank you so much. We have another question coming in for you, Shamali. You spoke about misconceptions about the AAPI community that could contribute to underinvestment in the healthcare needs of this community. How can we help debunk those misconceptions and shed more light on the healthcare needs of AAPI Virginians?
And thank you so much for that question. It's a really good question. A lot of people in our AAPI community don't want to talk about some of their struggles. It's very much part of our culture to keep that very internal inside our families. So I think as AAPI community members, being able to talk about struggles that we all have with one another is really important. So fostering some of those discussions helps educate both our community members that there is a need to share some of the struggles that we're having, especially with our elected leaders, so that they can better understand how they can support us in our needs. I think that the more we talk about issues, and I've done some televised programming on things like mental health care for our community, the more we talk about it and make it more open and acceptable to talk about it, the better off our community becomes. And I notice that as I'm out canvassing, knocking on doors, when I raise issues, often people are willing to share their stories of struggles that they've had. So I just encourage people to have community meetings. I love that Delegate Tran has had so many town halls, because those kinds of one-on-one meetings or community-based meetings make it much easier for our community to share the struggles that we're going through.
Thank you so much, and thank you to all of our panelists. Katie, that's all of the questions we have for now, so back to you.
All right, thank you so much, Fletcher. And thank you so much to our panelists, our legislative leaders, our champions. Just really grateful for all the work that all the speakers are doing in your respective spheres to be real champions of healthcare. And I'll just close by saying it was such a tremendous honor to shed light on the healthcare needs of our older Virginians, as well as our AAPI community. So thank you all very much, and I hope you have a great day.
Thank you.
Thank you.